The Lancet, through science and sharing that science and knowledge, actually want to make an impact. They want to improve the lives of people, and they want to do that by influencing the decision makers. And that's exactly what we want to do at the Lowitja Institute. Our findings show that wherever you might be as Indigenous people, in the main, you are behind the eight ball. You know, your outcomes in health and social circumstances are poorer than the wider population. The world is poorer for this continuing inequality and inequity. If Indigenous peoples the world over are experiencing inequality, dispossession, poorer health, poorer education, what does that say about a world that aims for all to be equal? So when we think about the importance of this collaboration, so we're sitting here in Melbourne today, and Melbourne did not exist as Melbourne when the Lancet saw their first edition, off the presses. So we've got this iconic medical journal, nearly 200 years old, working in collaboration with a small Indigenous organisation on the other side of the world, and together, this study will make a huge difference, I'm hoping. So having a national organisation like ours, the Lowitja Institute, can only go so far. Having this published in the Lancet gives it global reach. So when we think about what we can do here and our contribution, it's not just the contribution for Indigenous peoples of this country, but how we can support the efforts of others. And this report is really critical in that sense. It's a landmark report, something that's never been done before.
So the Lancet doesn't usually commission research. It's very rare for us to do that. And the reason that we commissioned this work was because there was this massive gap in knowledge around the world about Indigenous health. The Lancet has a lot of influence. It's one of the 2 top journals in the world. Its impact factor is more than 45, which is very high. And it has a lot of influence. The Lancet would like to revisit in a few years' time to see if there's been any improvement in any of the measures around the world, in any of the countries. And it would also hope that this work will improve the health of Indigenous people and possibly influence governments to take more account of Indigenous people. Over nearly 200 years of the Lancet, it's had massive influence in all sorts of ways. It was the first to publish about penicillin. It was instrumental in getting rid of flogging, and many other public health issues have been resolved through the Lancet's influence.
This study, we got data from about half the global population of Indigenous and Jobless peoples, biggest study ever of its kind, 28 Indigenous populations, 23 countries. It's the most comprehensive picture of Indigenous health ever to date. It should be a wake-up call to most governments across the world. In India, for the first time, we have comprehensive data on scheduled tribes, never before published. That is just a game changer. But it's also a game changer when it comes to wealthy countries, because the size of the gap doesn't change with wealth. We've got very poor Indigenous peoples in very wealthy countries. There is a standout that comes out of the report. We know that health is generally, not always, but generally poorer for Indigenous peoples across the globe, but we know there are big gaps in data, and the gaps leave unanswered questions. And the gaps are larger in data the poorer the country is. So there needs to be a real effort to assist poorer countries to develop the sort of government data systems that enables them to monitor the health of their Indigenous peoples. Now, there are other things that come with global collaborations. Not only do we get to work on projects such as this, but we also get to learn from each other. We learn what's happening in our countries, what sort of success stories. We learn from each other's failures. And so building those sort of global networks is one way to accelerate change. Indigenous and tribal peoples are part of the global human story. We have so much to contribute. We have so much to contribute in terms of our history and culture. Not only is it a moral issue and an ethical issue, but it is also an issue about the benefit we bring to humanity. This is the biggest study of Indigenous and tribal peoples across the world ever. There has never been a study as large as this before. Come on in. Yeah.
Yeah.
Keep it tight
Yeah.
on what you say. So say that